Aloha! Using osteopathic manipulative treatment, also known as OMT during pregnancy, is something very near and dear to my heart. It's especially important because around 50% of pregnant women will experience low back pain during their pregnancy. But a physician's hands are usually tied in prescribing medications because they may adversely affect the baby. I've had great experiences applying OMT during pregnancy. My most important personal experience was during my wife's pregnancy with our first child. About 3 weeks prior to her due date, we were at a Christmas party and she was wearing a shoe with a bit of a heel that slipped on a marble tiled floor and she fell right on her bum. That's the English way of saying buttock. This scared me for several reasons, and after we established that she was essentially okay, we were not surprised that she suddenly developed low back pain. I knew at that point in my career that OMT helped pregnant patients, but I was worried because I also knew that the ligaments become loose during pregnancy and that may have made her more susceptible to the adverse effects of the fall. I ended up treating her with OMT 3 days in a row to gently ease and reposition her hip bones that became displaced because of the trauma. To enable best outcomes, I treated her once a week after that using similar gentle OMT techniques until she delivered, including OMT in the delivery suite. Long story short, she did great and has had only a couple of bouts of minor back pains over the past 25 years of our lives. If our personal story convinces you that OMT will help with low back pain and pregnancy and some of the other body changes that occur during pregnancy, then you can probably call my office right now. However, there is a substantial amount of research to back up our personal experience, and I will continue with a discussion for those who may be interested. During pregnancy, a woman's body changes. This diagram shows an X-ray of the human spine with the triangular sacrum at its base and the various spinal curves as seen from the side. I've accompanied the X-ray with some highly diagrammatic renderings to show how, as the baby grows, the mass of the baby in a person's belly is accommodated by the curve in the lumbar spine increasing. The thoracic spine and cervical spine curvatures also increase to adjust for these changes. My main goal in discussing these changes is to lay the groundwork for discussing some of the research. The mechanical body changes may contribute to low back pain, neck pain, heartburn, carpal tunnel syndrome, leg and arm swelling, and headaches experienced during pregnancy. One of my OB-GYN mentors used to say that if a patient had any of these things going on prior to the pregnancy, then they would either get better, get worse, or stay the same. His main goal was to deliver that baby safely and prevent bad outcomes for the mother. My main goal is to make your pregnancy as good as an experience as possible by applying my training to lessen the impact those biomechanical changes and hurdles that one would encounter during their pregnancy. Let's start with discussing a meta-analysis published in the Journal of Bodywork and Movement Therapy in 2017. The authors examined 100 studies and found 5 that met their criteria for studying the effects of OMT during and after pregnancy on patients with low back pain. Meta-analysis studies are thought of as being able to produce the highest level of evidence-based medicine. In a meta-analysis, the researchers take multiple different studies looking at the same question, review the methodology of those studies and their flaws, and seek to find some common ground, which to synthesize the findings into a coherent message. The most common message that I've seen from a meta-analysis is that further study should be done. The conclusion of this meta-analysis was that OMT produces clinically relevant benefits for a pregnant or postpartum woman with low back pain. However, you guessed it, they thought further studies should be done. One of the cool studies on patients with low back pain during pregnancy was published in the American Journal of Obstetrics and Gynecology in 2010. They recruited 144 participants in their last trimester of pregnancy and divided them into 3 groups. One group received the usual OB care, another the usual OB care plus OMT, and another the usual OB care plus a placebo ultrasound treatment. The OMT performed was a standardized protocol. protocolized OMT is not the usual OMT done by a specialist like myself. The usual OMT performed is tailored to each person's individual clinical findings. The protocol they designed targeted the specific key biomechanical areas affected by pregnancy that I briefly reviewed earlier. They did this to assure that the NMM specialists participating in the study performed the same treatment on every patient. This is the kind of rigor a study uses to prove that anyone trained in the same techniques should be able to attain similar results. In other words, they were trying to make the OMT into a medication with a standard dose. The study showed that those receiving usual care plus OMT improved. Those receiving the usual care plus the placebo stayed the same, and those who had the usual care alone became worse. The researchers concluded that the OMT slows or halts low back pain during the third trimester of pregnancy. The last study that I'm going to chat about was published in the Journal of the American Osteopathic Association in 2015. The low back pain patients in this study were postpartum. There were 80 participants, with 40 in the OMT group and 40 in the control group that received no OMT. The OMT sessions were performed every 2 weeks for a total of 4 sessions. And unlike the previously discussed study, the OMT was tailored to the patient's clinical findings. Participants were not allowed to receive any other pain treatments during the study. The average severity of the pain in the OMT group was 7.3 on a 10-point scale at the beginning of the study period, and decreased to a 2.0 by the end of the 8 weeks. The average severity of the pain for the control group was a 7, and by the end of the study, it only decreased to a 6.5. There was a 75% decrease in the disability of daily life scale in the OMT group. 3 months after the last OMT session, the patients in the OMT group were observed to have continued levels of improvement with diminished pains and improvement in their activity scores. There are a lot of alternatives to OMT out there for pregnant people with low back pain. I hope that we can help some of those people at the Danto Osteopathic Clinic in the near future. Our goals for our patients are to normalize, optimize, and thrive. Ciao.